Today, nearly everyone has a navigation system built into their car. Some of us might remember the days of using MapQuest to print step-by-step directions, or even going to AAA for a TripTik, hoping to stay on track and not get lost. So much has changed in the past decade. Computer assistance has revolutionized how we live and work. From self-driving cars and robotics in the automobile industry, technology has transformed our lives. Surgery is no exception. Just 5 years ago, most orthopedic surgeons performed hip or knee replacements without advanced technologies. Today, we utilize advanced tools to ensure proper placement of implants, including navigation, improved instrumentation, and most recently, robotics. At Desert Orthopedic Center, in conjunction with Eisenhower Health, we strive to provide patients with excellent outcomes and expedited recovery. The Coachella Valley is home to an exceptionally active elderly population, whose goal is to return to activities like golf, tennis, and pickleball. Robotic systems such as the Mako by Stryker lead the way in hip replacements. Most institutions are fortunate to have one Mako robot shared among all orthopedic surgeons. High-volume centers like Cleveland Clinic, Mayo Clinic, or Hospital for Special Surgery may have a few more. However, Eisenhower Health currently boasts the highest number of Mako robots in the world. Supported by our exceptionally high volume of hip or knee replacements we perform on an annual basis. Our surgeons are among the highest volume of Mako hip and knee surgeons worldwide. In preparation for your surgery, we will order a CT scan of the affected area. The scan provides high-definition images of the hip or the knee. With these images, we will create a three-dimensional model of your hip or knee. Similar to how an architect designs a house on a computer, I too can design your hip or knee replacement digitally. Once the plans are finalized, they will be transferred to the robot for the day of surgery. In the operating room, I will make the initial exposure and introduce your hip or knee to the robot using robotic arrays placed in either your pelvis, femur, or tibia. Once the robot is calibrated to your exact location, it will assist me in making precise cuts and balancing the joint, ensuring a successful operation. Unlike the Da Vinci robot used for abdominal or prostate surgery, where the surgeon operates the console from several feet away, Mako robotic surgery is different. The surgeon is scrubbed in and performs most of the surgery. The robot has a handheld component requiring constant input from the surgeon. This is an exciting era in orthopedics, and we look forward to utilizing this incredible technology for you and your loved ones should you need a hip or knee replacement.